again, my name is Adam. I'm a two doctor working at UCLH at the moment, and I also work for Step to Med, which is really like a non-profit company that just helps people and with their medical school applications, whether that be graduate entry or undergraduate entry. And we also branch into the field of dental applications as well. So thank you all for attending. I'm just in this brief presentation, I'm just going to go over our story so far, to who we are, why applying for medicine is quite nice, and what you should think about before applying. The realities, though, of the career and what it's actually like sometimes, which is still great, I think, but we can discuss that further. The joys of being a doctor, whether you should apply or not, and how we can help you. It should be very brief, because the main premise of this talk is just talking about medical application in general. And finally, what points, as we are successful applicants and people who've gone through the process, and I myself and other colleagues have sat on the panels of interview panels, what points we've picked up on throughout the entire thing that people don't do and we think people should do. So again, Step to Med, we're just run by medical and dental students. We were created initially by medical and dental students when we were in university respectively. We've all now graduated, we're all now doctors, and we've done varying different courses and stuff in teaching and also in public speaking as well, to help develop the course criterion and also to help people with their applications. So a bit of background about me in general. So I grew up in Stoke-on-Trent. I did my A-levels and then I entered and applied for the University of Birmingham, where I went to. I applied there, I applied to Nottingham, Oxford, and to Manchester, and I had offers from Birmingham and Manchester, and I chose to go to Birmingham, mainly for the course design, and they did a pure lecture-based course at that time, which is still quite similar to what they're doing now, although it has changed a little bit. And then since graduation, I'm an academic junior doctor at UCLH, but also do some tutoring as well for medical students, and also in the Widening Access to Medical School scheme, which is on helping people applying to medical school. So again, this is the story of our company, that we created this idea. We worked in medical school to create this whole company, and now we tutor over 1,000 students from over 20 schools. So it's quite well established and quite well set up. And we do a variety of different courses and stuff, and we can talk about that at the very end, but essentially we help people with their applications, and there's more information on the website about that. So just a disclaimer before I go into this, that we don't tell any information, we can't disclose any information that's specific to the medical school in terms of we've sat on the interview panel, so we do know some stuff that might come up. We can't really disclaim that, but we can discuss it generally around the area. So life as a doctor, first of all. So you know that medical school is 5 or 6 years degree, 6 years in Oxford and in some London universities, although most places now, pretty much everyone does 6 years, except if you're graduate entry, you do 4 years. You'll be initially starting off mainly doing the basic sciences. You apply that later on and doing stuff with the clinical stuff later on when you go into the clinical years, and that varies. Most of the time, I think it's graduate entry, it's like 1 year of the basic sciences to 3 years of the clinical. The basic sciences bit is very theoretical. You just essentially are writing books. You will have some patient contact, but it's not really, you don't really understand much what's going on. The clinical is when you learn the actual applications. And again, it's mainly looking at the extremes, young patients to elderly patients. That depends on what areas you go into later on. For a dentist, it's 5 years degree, and in that you learn about oral health, cosmetic dentistry, the human body. And again, it's a very similar sort of process, but I think on graduation, there's not as broad a spectrum of stuff that you can go into, although there is quite a few things. What are the perks of doing medicine? So first of all, it's quite a satisfying job and it's quite unique. You get to, while it is long, it's a good time that you're spending studying. When you come out of it, you have a job that's pretty much different every day, and there's always a bit of a unique challenge associated with it. And that's regardless of whichever field you're going into later on. That can, even if you're in A&E, where it's so varied every single day, to working in like elderly care, you still have to deal with real emergency stuff that comes in. and it's a challenge and it's quite tricky, but it's very satisfying to do. I think as you go on, and I look at my other friends that are doing stuff like accountancy, no offense to anyone who does that, but I think your job is just so much different compared to other people. You can be very impactful to people's lives, and you enjoy the challenge that's associated with it. You are literally having to think every single second of what you're actually doing. It's not really that mundane in some sense. Everything's quite new, with broad variety, and it's very satisfying to yourself, humbling to be able to make. And you do make quite a big difference to people's lives. The challenges are that it's really busy and tiring, especially in training. I'll give you an idea of my schedule on A&E. So last week, Monday to Thursday, I was working nights here from 10 p.m. to 8 a.m. That was Monday to Thursday. Then Friday is like my post-nights catch-up, where it's a day of just trying to catch up on everything. I worked 1 and 2 weekends. So this was the weekend where I didn't have to work, but I was still pretty much shattered from my night shift. And then now I'm working Monday to Sunday, 8 a.m. to 6 p.m. So it's tough. A&E is notorious for being horrendously rotated, but as a junior, you will most likely be 1 in 3 weekends, 1 in 4 weekends. And it's tiring because you are constantly switched on. You can't really switch off at any real point. But in some way, that's actually quite nice because you get a lot of variety. And while it is hard work, it kind of pays off. As you go higher up the ladder, life gets a bit better and things do improve. So you can see the light at the end of the tunnel. You do have to sacrifice, as I said, I work 1 in 2 weekends, which is not compatible much with a life at the moment. But when you work on general medical stuff or in surgical jobs, you'll be about 1 in 3, 1 in 4 weekends at a junior level. As you go higher up, it gets better. So 1 in 5 to 1 in 6. But again, that means if you're someone who wants every weekend to be free, initially you will not get that. And even if you did the shortest training pathway for GP, that would just be 3 years. You'll still have to do 3 years of that. As I said, your social life takes a hit, and it can be emotionally challenging. You do see some stuff that's get quite hairy at times. Kind of come, I know it sounds a bit odd, they don't numb to it after a while, but you do reflect on it afterwards. But there is like good support systems as well to talk about that afterwards. So what's the application process? So just consider whether medicine's right for me, look at your grades, look to see whether you are a competitive applicant in this area, and gain insight. I think one of the big things, and one thing I'll say, is that medicine it's not a job, it's like a lifestyle that you're almost picking, especially the first, whatever you do, whether you do GP and that's 3 years, or whether you're doing surgery 8 years, it's a lifestyle choice that you are picking. And if you're happy with that, that's fine, but just think about it a little bit about what do you want at what point, like when you are a certain age, what do you really want to be doing? If you're not happy to still be doing night shifts when you're early 30s, then you need to consider what specialities really offer that. It's maybe just GP, that you don't have to do that, but is that something you're content with? And then you've chosen about medicine, then you think about now what? So carry out a variety of work experience and get involved. We'll talk a little bit about that. You do your admission tests, write your personal statement, go to your interviews and try and secure what you need to your position. We've released a variety of YouTube videos on that. You can have a little look at them and they talk it through a bit more detail. So work experience, especially during now, and in general advice for it. So the best thing with work experience is you have to be so organized and start really early with it. Give it, like, even if you know that you've got a period of leave coming up, you need to be really on it 6 months in advance, sending emails and getting things started. One of the best things, one of the nicest things on any application process is having a variety of different things on your application in terms of specialities. Medicine is so diverse, and whether you're in surgery, whether you're in GP, whether you're in psychiatry, they're completely different things at times. Try and develop a varied portfolio of experiences. I personally did experience in GP and also in psychiatry, and I have to say my time in psychiatry was one of the best things I did for my interviews. And from listening to other people, you learn so much, and it gives you a very different perspective on mental health. It's such a big thing at the moment in the NHS and in healthcare in general. It's a really nice area and a good thing to have almost in your arsenal of things to talk about. When you are on your work experience, really engage and get involved in things. Trying to do as much as you can and see different areas. There's you're working in a hospital, you can go to the ward, you can go to the clinic, you can go to the procedure room. Also try and speak to different professionals. One of the key buzzwords is the multidisciplinary team. That's the fact that in hospital, it's not just a doctor, there are nurses, there are obviously therapists, there are occupational therapists, there are dietitians. Speak to every one of them and know what each one of them does. And it's just, you do need to know that. When you come to your interview, it's just refreshing to be able to say and speak about all these different things. And reflect on it daily and write it. Write up what you've seen. And that's because when you come to your interview, you'll forget a lot of what's actually happened. And you need to be able to remember about what you actually had, how you felt when you saw those actual things, and what steps you take and you develop from each successive day of your work experience. It's almost like doing an internship. That's the way I would really think about it. Like, you need to go in there and not be shy and take as you are a prospective medical person, go straight in for it. Again, on YouTube, talk a bit more about that. Volunteering is quite good for long term and it shows good commitment, but that depends on whether you can commit to it. Its main benefit really comes in the fact that you're interacting on a regular basis. And again, you really need to have a logbook to show how you're developing over actual time. On our website, if you have a little look, we've created a bunch of pro formas and you can fill out these pro formas and they're quite good. Pro formas just help you reflect on what needs to actually be done. Again, it's like work experience. It can help you. It helps you when you come to your interview discussing things in more detail. So securing work experience, how to do it. I literally would spam people with emails, write letters, go to GPs, give like a letter in that you've written. Just do everything you can. Like if you don't ask, you don't get. And like you will realize this is like the first step throughout medicine. You will when you get into medical school and even further on from that, you just constantly got to like take every opportunity and there is no shame in it. You've just got to take it as it comes. No one's going to judge you for it. Just put yourself out there straight away. Because the worst thing that can say is no. And everyone in medicine wants to help someone else. That's why you're in the profession, because you want to help people. So when you have someone who's coming along who's motivated, you're very keen to help them. Give a good range of dates you're available, because sometimes there's more than one person who's coming. And always, like, one thing I think is really good is if you send an email and you don't get a reply, don't be disheartened. Just resend the same email 3 days, 4 days later. If you don't get a reply, resend it again. Obviously, if they're getting really annoyed at you, then don't do it. But it's their job to reply. That's why the email's there. And if you're not getting a reply after 2 weeks, then you know that no one's looking at this very much. But just keep sending it. Just go for it, and you will get somewhere with them. With that, if you don't, then you're not going to really get very far with it. Again, we've written like a template of a letter or an email that you can send on our website. So just have a little look, and it's quite helpful if you just want to have an idea of what you should write. That's kind of the template that we have. You can just fill out your own things. Just saves you a lot of time getting it done. One thing that's quite hard at the moment is virtual work experience. So, because I'm not sure with the COVID regulations which hospitals are allowing people in. Like, I know medical students are back, but I've not seen any work experience students. The Medical Schools Council had some online stuff that they could do, kind of a Zoom day almost. Also have a look at like online resources, blogs and videos. They're all still worthy stuff that you can reflect on. And I think this year especially, they're going to be more lenient with stuff because they understand that people have had a really tough time in applying, in getting experience in general. It's not been a normal year. So if you can do stuff like this, it's all about showing the fact that you are motivated, you seize the opportunities that are available. That's how they know that you really want to do it. If you're not going to do that, then they know that you're not that keen about it. So definitely have a look at them. There's also something from the Royal College GP, it's called Observe GP. That can be quite good, nice thing to talk about if you're in an interview. We've written our blog, top 5 book recommendations. There are webinars running. We offered a webinar series in last month on applications. And also just look at media articles. COVID is so big right now. You are really going to be asked about that in any interview that's going to come up. It's a good thing to keep abreast on. So our top tips are for your application and in general is when you are on work experience, always write down your observations, what you're saying. That's what I was talking about in terms of that logbook. Make contacts and almost network with them, keep them with you, always ask them for advice. As I said, every doctor is more than happy to help. I remember when I was a medical student, like there were people coming in for work experience and they would ask me, and I would more than happily help them, and then I would send me their personal statements and I would just review it for them for free. Everyone is more than happy to help. Like, so don't be put off by that. I said we've got a logbook, download that. Try and make keynotes in that logbook to reflect on, refer back to at any point. Again, in your interview, it becomes really important. It's also nice in a personal statement. And just speak to current medical students and dentists that you know to gain a better idea. And specifically, if you have a specific medical school in mind, it can be really helpful to talk to a medical student or a dental student who is at that place, just to get an idea of what it's actually like. When you're in medical school, dental school, you kind of get the idea of what other medical schools are doing. And I certainly have now my own opinions of having been to Birmingham Medical School and now come over to UCLH, which is a UCL-based medical school. There is definite differences between the two, and specifically differences if you have specific interests. You know that like you want to do psychiatry, you know you want to do surgery. There are definitely places that are a bit better for different areas. So have a little look at that. It's also useful to think about where you want to be in the future. Sometimes like where you go to medical school is probably where you're going to end up afterwards. I know I didn't do that, but I plan on going back to Birmingham, so I technically am doing that. So I'm taking a brief interlude. Most people that I know are going, most people from Birmingham are pretty much close to Birmingham. So this is just a reflective logbook. As I said, you've got these, you can download them, you can use them as much as you want. I'm just looking on our website. Reflection is the key word. It's really important that you do reflect. It's one of the most important things in medicine. And reflection means just identifying your weaknesses and identifying proximal goals by which you can develop from that and showing that into the actual future. We'll discuss this more in our interview course and our personal statement stuff as well, that you need to be showing that all the way. It's kind of like the way that you demonstrate that you do take things seriously. You are developing self-improvement at all times. And again, it's another example of it. In terms of the UCAS application, so 15th October is the deadline for medicine and Oxbridge. Some places might ask you to submit extra stuff. So Manchester asked for an extra form to detail non-academic information. Nottingham asked for dates of supervisors' names for work experiences. You don't know what they might do. They have every right to ask everything from you. So never ever lie on your personal statement or on your work experience in terms of what you've done. Just be honest and truthful, and you shouldn't do that. In terms of the interview, there are different interview styles. There's the traditional 2-panel interview, which has gone a bit out of favor now, and there's the multiple mini interviews, which is becoming more and more and more popular. So in the traditional, it tends to be very set. It's just more general questions. There can be an ethical discussion, discussions on personal statement. But the multiple mini interview adds extra levels onto it. You'll have practical tasks and exercises to do, more stuff on moral judgment, because you've got those 6 to 7 stations in which you can test specific aspects that you really want to look at. I personally preferred the multiple mini interview, and I still prefer it. It's a really good format, and even if you mess up on one of the stations, you're absolutely fine going to the next station. But not to say the traditional interviews are quite nice. We, in our interview talk, of course, talk a little bit more about them, especially on the best ways to format your discussions for each of these areas. So when you have a personal statement question or a work experience question, there are specific ways that you can look into answering the question to format your thought processes and what you're saying, and really just be comfortable and confident in what you're saying. And that's actually one of the best things you can do. If you're confident in what you're saying and you're coming across as a genuinely nice person, you will score very good marks. In general, the themes that tend to come up, as we discussed a bit before, are about yourself, why you want to do medicine, what knowledge you have of the specific medical school, and your work experience. But not to say you will have tasks and multiple mini interviews to conduct. So we run this interview course. It's called Step to Interview. Essentially, we talk a little bit, I've covered this a little bit, about the different interview styles, our top tips for the interview, questions. We talk about work experience and how to cover questions that relate to that, your personal statement. When it comes to ethics, there are big buzzwords that you need to know. There are the 4 pillars of medical ethics that are really important to look into. I learned it only by chance. I didn't attend any of the course, but I was really lucky that I learned about these pillars, and it was so important, so useful. We talk a little bit about communication, how role play can come up, the NHS, and what's quite hot right now to talk about. And we give you a mock interview as well in that to give you constructive advice on how to develop. What extra reading can you do to help your application? So definitely read around the subject. And one thing that I read was quite good was when I was on my psychiatry work experience was Sylvia Plath. She was like a poet who also suffered from depression and anxiety, and she wrote The Bell Jar. And that was a nice little aspect that I could talk about and bring into the interview to talk about how people feel and mental health and relate that to the actual work experience I did. There's other great books, like Oliver Sacks is a neurologist in America. He's a very, I can't remember the name. He wrote a book, something about a hat. That's a really good book to read as well. There's another one on ethics. I can't remember the name, but it's about a utopian world that we live in the future, and it's quite a nice area to look at. And what that gives you is something different to talk about in your interview, something that gives a niche aspect to you and makes you a bit different. Definitely prepare in advance and read ahead. It's like sometimes like going for a job interview. Like you don't prepare, you will not do very well at all. If you hit at school or university, you have a med software application. And also it's really important that you have a balance in everything. If your application to have sports and music aspects to it and relate that to how that will make you a better doctor, which it will, because there's always aspects in everything about teamwork and leadership that are very important. As I discussed, organize your work experience early, get good grades, read regular issues, organize a journal club if you want to, and activities. How can we help? So as I discussed, there's quite a lot of free stuff on our website. So have a little look. It's quite useful. People have found it really useful. Even if you don't attend the courses, go on that and have a look. I think that is really helpful, and I wish I had something like that when I was applying. That's why we really did this, because we just wanted to help people. So definitely take a little look. I think that's really important. We've got a free guide online as well. If you want some more advice, definitely email us. We're very approachable, more than happy to help you. Got this YouTube channel, which my colleague Pooja is running. It's really good. She also does some Facebook Live seminars, and it's really quite interesting, and it gets quite involved into actual stuff. And we write a blog, and you keep up to date with that. It's also on Instagram as well. We have some stuff on that going. So definitely follow, and even if you don't have to attend some of our courses, I still think it's really helpful just to follow us and to get an idea of what's going on, to keep up to date. There's no harm. It definitely will help your application. So as I said, we've got a blog. This is our website. Have a look at our blog. A bit of interesting stuff to talk about on there. Definitely take a little look. And again, stuff on work experience as well, updates that are going on in COVID. Pooja's really good. She's really on it with this sort of stuff. I'm more involved in the course design side of it. She does more of the website and getting things up to date. We also offer webinars, as I said, really free, and Pooja does them. They're really good. You just literally go in and you ask whatever question you have, and she's happy there to answer it. Pooja's, sorry, I should explain, it's my colleague. She was in my year group as well. She designed this company. She's an academic F2 in Leicester in pediatrics and budding pediatrician. And we've got a YouTube channel, free videos for everything. Definitely check it out. It's really useful. I think it's great. So there's an example of it. You can see what videos we've got on there, how we help with your application, work experience, how to organize it. It's really helpful. And definitely email us if you've got questions about it. And we're on social media for regular updates. we offer like a proofreading thing as well called Step to State. Again, just have a look at the website. I'm not going to bore you with this. Like, just have a little look. If it's for you, all the information is there. And if you're not sure, just email us. We're very friendly and happy to help. So in summary, I've told you our story so far. We've discussed a bit about medicine, why I think medicine is a great career. And if you've got more questions, I'm happy to tell you them. I think it's a really good choice of a career, to be honest. Like, I think I definitely went through a period where I think I started this job and I found it very difficult and I didn't know whether I was cut out for this, but I really think I've grown into it. And now I really love it. And I think it gives you learn so much every single day. You get to interact with so many different people and it's completely different to everything else you do. And while it is tough and the hours initially, it gets better as you get on, are tough, it definitely pays off in the end. The reality of the career are long hours and stuff like that, but if you enjoy what you do, which I do, and most doctors do, you'll really love it, and it'll be something that you're almost part of an exclusive club almost of doctors, and it's a nice world to be in, I think. It's really lovely being able to help people, to be there. One of the nice things is to be able to use your knowledge and have a direct impact on someone, such that if they're in pain, to use what you know, devise the situation, take a history, examine them, use all that you've learned from all that time into managing that situation. It's a really amazing thing. Should you apply, have a little think about what you want, specifically in terms of what you want for the future, what you want in terms of whether your grades are satisfactory, and at the end of the day, you can give it a shot. And definitely have a go. Use all the resources. We are definitely here and happy to help you at any point. Again, we can help you in every step of the way, and definitely make use of our free resources. We're definitely there to help you out. And maximize your application by doing that. Thank you so much for listening. I hope that was helpful, and I hope I've not spoken too fast, just because I know whether I have 30 or 40 minutes, so I timed it 30 minutes. Please ask any questions that you have. I've not gone in too much detail about what we offer, just because I want to talk to you about medicine and about my career and experiences and what I wish I had done, and I wish I could tell every prospective medical student about. I don't really want to, but if you want to, we can go ahead and talk about what our course offers. That's all on the website, and you can have a little look at that. So definitely check out all our free resources: YouTube, Instagram, and Facebook. Thank you so much.